Here is a goniometer. Keep in mind that the goniometer actually is composed of three different parts. We have an immovable or a stationary arm that's actually connected to the protractor, and then we have the movable arm that follows the motion of the patient. In the middle of the goniometer, where the screw is located, is what we call the fulcrum. The fulcrum is also lined up with the axis. So with that being said, let us begin with our goniometric measuring. Okay, we got Sade here on the plinth in a supine position. We're going to be measuring her elbow extension and flexion. Really a set of measurements, but only recorded as one. Notice her palm is in an upright position, really in, I guess you would say, the anatomical position. But the motion itself requires her to stabilize her humerus. Notice we have some support here for her glenoid fossa, and she simply brings her hand to her shoulder with her elbow as tight as possible. When we get the goniometric measurement involved, we look at the lateral epicondyle of the humerus as the fulcrum or the axis. We will line the stationary arm up with the humerus and the movable arm up with the lateral aspect of the radius. And I'm going to ask Sade if she will bring the palm of her hand, keeping her arm in a stationary position up to her shoulder, making her elbow as tight as possible. And then I want to find the radial styloid as my point of reference. And I record her at 140 degrees of elbow flexion. However, when we write this, we write 0 for the extension, just where we began, / 140 degrees. The normal movement for elbow flexion is 140 to 150 degrees.